Morning, it is time for your health check. You know, mental health has become part of our collective conversation more than ever before, and it should. Suicide is the second leading cause of death among teenagers, and 25% of kids screen positive for depression and anxiety. So this month, I'm making mental health a focus, highlighting UT Southwestern's Center for Depression Research, which is already making an impact.
We know this is a brain disease.
Dr. Madhukar Trivedi has made studying the brain his life's work.
Depression is very common.
In 2015, he founded the Center for Depression Research and Clinical Care at UT Southwestern Medical Center's Peter O'Donnell Brain Institute.
It is everybody's actually business to help each other.
Dr. Trivedi says as rates of suicide increased and more people suffered, research scrambled to keep up with why this is happening. He points to three reasons in his research why it is. 1, lack of attention to early signs and symptoms. 2, the added stressors of the COVID pandemic. And 3, the effect of social media.
On the one hand, teenagers and young adults feel like they're connected because they're on social media constantly. On the other hand, it creates a sense of isolation.
The whys are part of what the center is studying. They have 3 areas of focus. First, doctors are working to find new ways to help people who haven't benefited from traditional treatment.
And it's not just medication, it is also therapy, it is also exercise, it is also behavioral activation, it is also some community work, etc.
Second, researchers are developing brain and blood tests that can be used routinely in practice by doctors anywhere.
So that when somebody comes in and says, I'm not doing well, we can do those tests, come up with an algorithm and say, this is what you have, this is the treatment you should have.
And third, they're partnering with community leaders through 2 large initiatives. In clinical practices, changing the way hospitals and doctors screen for and treat depression, and in schools.
Like we have annual physicals, we should have an annual mental health checkup.
So over the next month, I'm going to explore what is depression, how is this clinic's innovative research already saving lives, and how do you know if you or someone you love is depressed? What do you do next? One of the major components of the center's work happens inside schools. As I just mentioned, I'm going to show you what they're doing and how it's already helped. That's coming up next week.
Another example of it's not just one thing that's going to fix it all.
Correct.